Thank you, Mr. Speaker. In 1991, I suffered a spinal cord injury. After being treated in acute care, I immediately went into rehabilitation at the Calgary General Hospital. I was lucky, Mr. Speaker, as research clearly shows that it's important to move to rehabilitation as soon as possible. It has come to my attention that lately there is now a 3 to 4 months for some spinal cord injury patients to get into rehab. To the Minister of Health, why is care for spinal cord injury patients so much worse now than it was when I had my injury some 18 years ago?
The Honourable Minister.
Mr. Speaker, I would endeavour to ensure that what the member is, his facts are accurate. I want to check to make sure of that, and I will respond to his question when I have the facts, Mr. Speaker.
The Honourable Member.
Thank you, Mr. Speaker. This delay in availability of rehabilitation services is not only an affront to the woman or man who has suffered a spinal cord injury, but it also adds additional costs to the system as they're shuffled from acute care to home to possibly long-term care and then back to rehabilitation. Does the Minister accept that on top of the medical impacts on the person who's had a spinal cord injury, this also seems to be an unnecessary cost to the system?
The Honourable Minister.
Well, Mr. Speaker, I believe I've said in this House before that one of the things that troubles me about wait lists is that somehow the Canadian way of having to wait for health care is okay. It's just a matter of how long. I think we should be shooting for a vision in this Assembly that our health care system is there when we need it. And so I'm not going to acknowledge that any particular wait list or wait time is acceptable, and in many cases the member is absolutely correct. Wait lists actually cost us money.
The Honourable Member.
Thank you, Mr. Speaker. To the Minister of Housing, oftentimes if people are, after they leave acute care, or if they're lucky enough to get into rehabilitation services after this happens, oftentimes what is happening, they're being shuffled off to long-term care facilities, Bethany, or some other places like that. These are often 18, 19, 20-year-old individuals. It seems like they're being warehoused. Is this really the way forward here in Alberta for individuals like this?
The Honourable Minister of Housing and Urban Affairs.
Well, thank you, Mr. Speaker. I can't speak to why people have moved from acute care to the long-term care that you're referring to, but I can tell you this: that we do have 1,600 housing units in Alberta that assist people with special needs, and that, Mr. Speaker, would include people that require wheelchair access. And also we try to, and I think we do a fairly good job with this actually, but through our rent supplement program we do assist people with lower rents and with affordable housing, Mr. Speaker.